His Majesty, King Felipe VI of Spain. Please join me in welcoming to the stage the President of the European Society of Cardiology, Professor Thomas Luscher.
Su Majestad, el Rey de España, Don Felipe VI, señoras y señores, es un gran placer y debo decir un verdadero honor darles la bienvenida a esta sesión extraordinaria que clausura un congreso de gran éxito en Madrid. Ahora en inglés. Well, we're delighted to tell you that this is the first time we are in Madrid, and it was already a great success. I should say the biggest success ever. We have more than 33,000 participants and a fantastic program. And we were celebrating the 75th years of service of the European Society of Cardiology to reduce the burden of cardiovascular disease. And of course, we also enjoyed the city of Madrid, and yesterday we were impressed by El Prado and the fantastic Spanish painters that you have in your history. It's a worldwide congress. The topic was global health, and indeed the European Society of Cardiology, although our name is European by nature, is a global society with a reach through 167 countries. And you can see here that Germany was leading with the United States also, so we're delighted to have colleagues from across the Atlantic, the United Kingdom, Italy and Spain, number 6, followed by lots of other countries. But of course, we were hoping that being in Madrid, la capital del mundo latino, as I said in the opening, that we would attract more colleagues from South America, and indeed we did. We had from all the countries of Latin America 2,820 participants, and we're delighted that we could expand our reach throughout the world. Okay. Doesn't want to move. Okay. Now, of course, what the program was the most important. Participants alone don't make a success, but we had hotlines with late-breaking clinical trials that will change clinical practice. So we want to have an impact and reduce the burden of cardiovascular disease, and we did. In 10 hotline sessions, we had 20 papers online published in the New England Journal of Medicine, 33 in our home journal, flagship journal rather, the European Journal of Cardiology, and others in the Lancet, JAMA, and so forth. So this will have an impact when you go home on your clinical practice. And then, of course, we had 5 guidelines that will guide you in topics that are relevant for your clinical practice. And we publish guidelines, as you know, every year that should help you to reach the right decisions to provide optimal care to your patients. And this year, we're proud to present guidelines for the management of valvular heart disease. And of course, that has changed dramatically with the introduction by Alain Cribier of transfemoral or transarterial valve replacement, TAVI, and we have changed some of the indications that will help now a broader patient population. Then also the inflammation of the heart muscle, myocarditis and pericarditis, is a relatively rare disease, but also deserves to have guidelines, and this was presented as well. And further, we also had other guidelines, if I can move the slide. First of all, pregnancy and disease. Pregnancy is, of course, something very welcomed, but it also can come with health problems, and therefore we will guide you in the management of cardiovascular disease and pregnancy for those who have cardiovascular disease or get it during or after pregnancy. And then, of course, atherosclerosis is the main killer of patients or the population at large in Europe, and therefore the management of dyslipidemias, cholesterol, lipoprotein(a), triglycerides, and the like is center stage and thus deserve an update. So we already after 2 years we were able to have a focused update because of course there's so much progress in this area. And finally, mental health also is an important consideration for our patients, because if they're healthy but depressed, that's not what we would like to have, and therefore we felt it is timely to talk about this aspect as well. And then, of course, I would like to compliment the Spanish nation for the cardiovascular health plan that was provided thanks to Hector Bueno and the team of the Spanish Society of Cardiology. This was a role model for us across Europe, and now we are glad that the European Union has announced on December 3rd, 2024, almost a year ago, Cardiovascular Health Council calls for more robust efforts to help prevent cardiovascular disease, which remains the major cause of death across Europe. And you can see here in the press release, it's about prevention, it's preventing measures, equal access to care across Europe, health checks, and I should mention that Borja Ibanez from the CINIC has organized, together with our team and myself and Tom Gusick, a health check for physicians, and we had 1,200 colleagues that took the risk to check their risk factors, and we will hopefully have an interesting result, and we will certainly publish that to let you know whether physicians are as good as the patients in controlling their risk, or maybe even worse. We will see, and stay tuned for that. And then, of course, they want to train healthcare workers and reduce overall the prevalence of the disease across the European population. This is Oliver Verhalli, the Commissioner of Health, with whom we had the pleasure to meet on several occasions and make sure that this health plan will cover the topics that we feel are center stage and most important. And these are the big three that we are considering in this context. We would like to embrace the power of artificial intelligence, strengthening data collection through our registries, and use it for better patient outcomes, personalized care. Second, we would like to restore the European Union as the world leader in cardiovascular research. So we would like Europe to stand up on a strong tradition and continue to be an innovative place for our patients and the population at large. And finally, we would like to, of course, improve the population health and create a more resilient family. So with this, I would like to really, again, also in English, say that we are really pleased, gracious, and honored that King Felipe VI came to us to greet us, and before he will come to the stage, I would like to invite my good friend and colleague, Dr. Val Fuster, who doesn't need any introduction. Well, join me on stage. Thank you.
We are delighted to welcome Professor Valentin Fuster.
So, Dr. Luscher, let me start by saying that you began speaking in Spanish. I am actually from Spain, so I will speak in English. So, Your Majesty, Your Excellencies, and distinguished guests, I'm going to be talking about the importance of the heart around the world. It is an honor to speak before you today about a subject that unites us all, the importance of the heart in our world. The heart is not only a vital organ sustaining life, it is a symbol of resilience, connection, and shared humanity. Allow me to highlight 5 critical points that define the current cardiovascular global health situation in 2025. First, around 80% of cardiovascular events occur in low and middle-income countries, where access to effective treatments and adherence to medications remain minimal. This underscores the pressing challenge of inequity in healthcare delivery, fundamental concern of science, health, and education worldwide. Second, projected from 2025 to 2050, the standardized disability age-adjusted life years of the overall cardiovascular risk factors are expected to decline, which suggests improved management. However, the absolute disability life years will rise despite of age. Why? Due to population growth, aging, and relative high incidence of hypertension and obesity, all creating long-term health and economic pressures worldwide. Number 3, accordingly to what I said, the economic burden of cardiovascular disease and stroke from 2020 to 2050 is expected to increase substantially. Number 4, as mentioned, obesity and high blood pressure as modifiable risk factors are 2 critical problems to be addressed, with hypertension having a significant impact in cardiovascular disease, dementia, and overall mortality, making early intervention absolutely essential. And number 5, in regard to dementia and Alzheimer's disease, as shown in the ARIC study, from age 55 to age 90, the lifetime risk of dementia, including Alzheimer's disease, is 42%. This is a reality. So, having outlined this global landscape or in 5 critical points, let us consider how these challenges unfold across the 3 stages of life. The first stage, from birth to 20 years, is a period of vulnerability, but of significant opportunity. In many regions, inequities in education and healthcare create early disadvantages that increase the risk of cardiovascular and mental health later in life. But importantly, children and adolescents are the future leaders of the world. Early intervention will determine our future. The second stage, adulthood from 20 to 60 years, brings new and pressing challenges to the heart. Early detection of subclinical disease and management of cardiovascular risk factors, including, as we mentioned, obesity and high blood pressure, all become increasingly critical. And the third stage, from 60 years onward, confronts us with the profound challenge of aging, neurodegeneration, and multimorbidity in part preventable. Your Majesty, ladies and gentlemen, across all the stages of life, the heart reminds us that science, health, education, and equity are deeply interconnected. The challenges we face are not the responsibility of physicians or policymakers alone. They require vision, solidarity, and shared commitment from all sectors of society. Let us reaffirm our resolve to ensure that every child, every adult, and every elder is given the chance not only to survive, but to thrive with dignity, health, and hope. Thank you.
We are also pleased to welcome Mrs. Monica Garcia, Minister of Health of Spain.
Good morning, Your Majesty, Director General of the NIC, Valentin Fuster, Valentin Fuster, President of the European Society of Cardiology, Professor Thomas Luscher, professionals, researchers, colleagues, and friends. Let me begin with a sincere thank you. Thank you to the European Society of Cardiology for choosing Madrid to host this important Congress. Thank you to all of you, all the health professionals, researchers, institutional representatives, for the incredible knowledge you have shared over these days. It's a truly pleasure and honor to me as a Minister of Health that Madrid has been, for a few days, the beating heart of world cardiology. The theme of this Congress, Cardiology Beyond Borders, reflects perfectly what we have experienced, a cardiology that goes beyond not only geographical borders, but also beyond borders between the different disciplines, the different healthcare systems, and the inequalities. The diagnosis is well known. Cardiovascular diseases remain leading the first cause of death in Europe and worldwide. Every year, cardiovascular diseases take more than 20 million lives. In addition, nowadays in Europe, cardiovascular risk factors continue to impact health. 1 in 4 adults smokes, more than half of the population is overweight, hypertension remains uncontrolled in too many people, and to these risk factors we must add environment determinants such as air pollution and climate change, which act as silent multipliers of cardiovascular risk. And we must also remember that many women continue to be underdiagnosed or diagnosed too late, which shows the urgent need to truly integrate a gender perspective in cardiovascular health. But this Congress has also shown us that we have answers, that you have answers, that the science have answers. It was a privilege to hear about clinical trials that change paradigms, about innovative treatments that bring hope to millions of patients. We have seen guidelines being updated with new approaches. We have seen the limits of beta blockers. And we have witnessed the enormous potential of digital tools and artificial intelligence. Scientific societies have been clear on their demand. We need comprehensive cardiovascular health plans, both at the national and international and European levels. Plans that, like Europe's Beating Cancer Plan, mobilize resources, bring strategies together, and make the fight against cardiovascular diseases a political priority. So in Spain, we are fully aware of this urgency. We need comprehensive cardiovascular plans. That's why in April 2022, the Interterritorial Council of Spain's National Health System approved, with the consensus of all the autonomous communities, the Spanish strategy on cardiovascular health. The strategy has a clear goal to improve cardiovascular health in Spain and reduce inequalities with three main pillars: stronger public health, better coordination across different levels, and tackling inequalities. The strategy is made up of 134 actions and highlight the four most prevalent conditions and includes all the process from the prevention to the acute care, chronic care, rehabilitation, and long-term recovery. And it was developed with 100 experts and patients. Since then, we have created a repository of good practices, launched pioneering programs such as Código Shock, Código Infarto, and the National Cardiac Arrest with the Spanish Society of Cardiology, whom I would like to thank for their work and commitment. Our strategy has served to boost the European Cardiovascular Health Plan, and we are strongly committed with this European plan. And we have placed prevention at the center of our policies. We have launched a new law against tobacco. We have launched a new law against alcohol and minors. And we have a very ambitious plan about childhood obesity. I want to highlight the importance of international cooperation. The cardiovascular system itself teaches us that every organ and every cell depend on a dense network connected by vessels, that the heart on its own is not enough to blood if blood does not reach every corner of the body. In the same way, our fight against cardiovascular diseases requires a global circulation of knowledge, innovation, and cooperation. Only if we work as an interconnected system, we'll be able to bring oxygen and hope to humanity. I'm going to finish, but I would like to finish with an anecdote. I am an anesthesiologist. I've been working at the hospital 22 years until 2022. And one day I was with my resident, seeing a patient, a woman, at her room, and she has a cardiological disease, I don't remember which one, but we were focused on the sounds of her heart. The third sound, the fourth sound, the gallop rhythm, the mitral murmur. And then one of the residents put the stethoscope, looked at the patient, looked at her, and said, "Don't worry, your heart beat so beautiful. Tu corazón late precioso." So in this moment, this patient smiles and began to trust us. This anecdote always reminds me the importance, the powerful of the empathy in our clinical practice, in medicine, but also in politics. Empathy is the medicine of the soul. So I finish with another thank you. We are always learning and trying and learning. In this objective, you can count on the Minister of Health and with the government of Spain. Let's learn and beat together. Thank you very much.
Ladies and gentlemen, it is now our great honor to invite to the stage His Majesty King Felipe VI of Spain.
Good morning. Buenos días. Ministra de Sanidad, President of the European Society of Cardiology, President of the World Heart Federation, Director General of the CINIC, the Centro de Investigaciones Cardiovasculares, Carlos III, my dear friend Valentin Fuster, Presidente del Comité Ejecutivo de IFEMA, our host here in this fantastic facility here in Madrid, autoridades, dear participants in this Congress, professionals and leaders of cardiology worldwide. Maybe I don't have to say it, but I am not an expert. I am not a cardiologist. I am not a physician. But I am a human being, so speaking from the heart, I hope to say a few things that are coherent with what you are trying to do here and what you are trying to do permanently during your professional lives. Allow me to offer all those coming from abroad and from faraway places a warm welcome to our country, to Spain, and here to Madrid, our nation's capital. I know you're about to leave, but in any case, it's the first time we meet, so welcome anyhow. It is a true honor for me to address you at this special session held on the last day of the European Society of Cardiology Congress. What is probably Europe's largest medical congress has once again been a truly global event. In this Madrid session, with more than 30,000 registered participants from 170 different countries and territories. But apart from the numbers, the view from this stage, which is truly impressive, gives a good idea of the true magnitude of this event because of what you all represent. In a collective sense, this is an enormous and vibrant scientific community coming together, so diverse and so full of young professionals as well. And in an individual sense, well, just think of when each one of you returns to your universities, your hospitals, your clinics, your laboratories, or your offices in public service, to step up your work and continue making medical science and practice an ethical gold standard for society as a whole. Dr. Gregorio Marañón, some of you may have heard his name and have read his works, a preeminent figure in the history of Spanish medicine and thought, once said, "The true greatness of science is ultimately measured by its usefulness." There is no greater and clearer example of that than the field of cardiology you all focus on. Therefore, allow me to highlight, very humbly, three basic aspects that I believe clearly sustain and help understand its usefulness. In other words, its greatness. As obvious they may be for you, they are of course of huge significance not only for any individual, but also for the entire global community. The first aspect is the treatment of cardiovascular diseases, which are the leading cause of death globally, as we well know, and their consequences in terms of premature deaths, disability, and other irreversible impacts on the quality of life of so many, not forgetting the huge demands and impact and strain placed on our public health systems. They're on the front line against disease, whether you are working in hospitals or research centers. Your talent and hard work is absolutely vital for all of us. The second aspect is, of course, prevention, something I have personally heard so much about from our good friend Valentin Fuster. Although I would go so far as to say that this aspect deserves the biggest attention and understanding if we truly aim to effectively bend the curve with lower costs, both human and financial. Risk factors such as alcohol, tobacco, even vapors or other similar devices, stress, poor or unbalanced diets, especially containing ultra-processed products, lack of physical exercise, obesity, overweight, hypertension, and sleep disorders, circadian deregulation, may result over time, especially if left unaddressed, in severe illnesses. Here too, by promoting a healthy living, you play a crucial role, something that our education systems should also consider to address in a more serious way. The third aspect is about alerting society to the dangers of exogenous factors, as the Minister mentioned, such as pollution and climate change. Human health is inextricably linked to the health of the environments we live in, and your advice, in dialogue and cooperation with other scientific fields, can help us build a better society that is more aware, more responsible, and more sustainable, and given the close ties between health and well-being, happier as well. Ladies and gentlemen, in Spain, we are deeply proud of our health system, however much we aim to reach even higher grounds. Proud of its exceptional, accomplished professionals, and proud of its technological resources, and proud of the care provided at its hospitals. Public health is one of our greatest collective achievements. Spain, as the Minister has said, set the precedent in Europe by adopting the cardiovascular health strategy in April of 2022. But the advances in our health system are very closely tied to our recent history, in particular to the close to 5 decades of democracy, modernization, and social cohesion with greater rights and freedoms. There are two the most tangible expression of the ethical ideals that guide our actions. Because the most advanced societies are not necessarily those with the most material wealth or technology, but rather those that endeavor to meet the needs of all their members. It is a never-ending task, but one that will always be worth striving to fulfill. Ladies and gentlemen, we are living in an incredibly complex times in which it is more important than ever to meet, to discuss between different viewpoints, to share ideas, and to think about the future together. Over the past few days at this Congress in Madrid, you have once again provided us with a valuable example of dialogue, because cardiovascular health, as we are reminded by the theme you chose for this year's Congress, is a global challenge, and because knowledge, when it contributes to progress, should encounter no borders. Please allow me, therefore, on behalf of the Spanish people, to express our gratitude for the more than 1,100 sessions held during these tightly packed days, which I hope have not prevented you from enjoying our hospitality. Thank you, and above all, for your commitment to your profession, to your vocation, for making medicine a constant opportunity for learning. And finally, I urge you to keep this spirit alive, because your achievements and your discoveries, to return to the words of Dr. Marañón, will enhance the greatness of science and will continue to be useful to the betterment of our world. I wish you all, dear participants, a happy and safe return home. Thank you all very much, and congratulations.
I thank His Majesty for these inspiring words, and I thank you for attending this exciting session, and I wish you a nice remaining day, and see you next year in Munich. Thank you for coming.
We kindly ask you to remain seated until His Majesty the King has left the auditorium.